what determines what we can do for peritoneal disease? Because it comes in so many different flavors in terms of how much disease people have and what type of disease they have. So a basic assessment when I see a patient in clinic for the first time is that I need to know what their overall medical status is. Are they healthy enough for surgery? Do they have a good enough nutrition? Do they have any other medical problems I need to know? We then do evaluation with imaging, either a CT scan or an MRI, sometimes a PET, and take a look at how much disease we can see on those images. A lot of this is also determined by biology of the tumor. An appendix cancer in the peritoneum behaves much differently than a gastric cancer in the peritoneum. Appendix cancer, we can talk about cure and many, many years of survival, whereas gastric cancer can be very aggressive and we can talk about only months of survival. We also look at tumor markers in the blood. These are molecules that are unique to being secreted by the cancer, so it helps us monitor things and get an assessment of disease. There's also an assessment with right now circulating tumor DNA that helps. Now, I want to give a disclaimer about all of this, is that it's not perfect. Peritoneal disease can be the size of a grain of rice. And when the tumors are that small, even if there's a lot of them, sometimes we can't see them on the scan. And so that consequently tricks us in terms of diagnosis and who's going to be eligible. This picture up here is a photo of a diagnostic laparoscopy I performed on a patient. And it was someone that when I looked at their imaging, I thought they might be eligible for CRS Hipec. But when I got in there with a camera and looked around, I could see these little implants on many areas of the small bowel and the mesentery. And in those situations, I can't remove all that disease without hurting that patient. And so that patient actually ended up not being a candidate for cytoreductive surgery. And so the point of me saying this is that peritoneal disease is really tricky and we're limited by our modern assessments. That makes peritoneal disease hard to study in clinical trials, because when doctors give new medications they want to test out, they want to be able to monitor it over time. And if we can't do that on a CT scan, it makes it hard to know if a drug is working or not. So the fifth part that I put in here for assessing the disease is doing a diagnostic laparoscopy, and that's determining the disease burden and the distribution of it. If it's on critical structures like the small bowel or the porta hepatis, which is the blood vessels to the liver.